Hey everyone, welcome back to the LabMate channel. Today we're diving into an interesting case study involving a 25-year-old female patient with a suspected UTI. We're going to break down the lab results, analyze the findings, and answer the all-important question, is this culture significant? Let's get into it. So, here's what we know. The patient presented with a 24-hour history of dysuria. That's a fancy word for painful or difficult urination. Based on the clinical symptoms, the doctor suspected a UTI and ran some lab tests, including urinalysis and culture. So let's take a look at the findings. First, the dipstick test shows that leukocytes are 1+ and nitrate scant. Now when we move on to microscopy, leukocytes are 15 to 20 per high power field, which is significant. Erythrocytes are less than 2 per high power field. Squamous epithelial cells are double plus, which is quite a lot, and bacteria is present. Right away, we can see a couple of things. The elevated leukocytes tell us that the body's immune system is responding possibly to an infection. The scant nitrate result is less convincing. Normally, a positive nitrate test indicates bacteria, but it's a little weak here. And finally, the presence of squamous epithelial cells suggests potential contamination from the skin. Next, let's move on to the culture results. The key numbers here are that over 100,000 colony-forming units per milliliter, which is considered the threshold for a significant infection. Now, the catch is that the culture grew mixed intricts. Both lactose fermenting and non-lactose fermenting bacteria grew on the culture plate. Plus, there's mixed skin flora, including lactobacilli, Quagley's negative staphylococci, and Corynebacterium species. So what does this tell us? Mixed growth like this, especially when you have skin flora involved, often means contamination, especially when there are a lot of squamous epithelial cells in the sample. It suggests that the urine sample may have picked up bacteria from the external nether regions rather than reflecting what's going on inside the urinary tract. So, the big question is this culture significant? Let's break this down. Leukocytes and bacteria in the urinalysis suggest a potential infection, but the mixed growth of skin flora and squamous epithelial cells hint a contamination. In a true UTI, you usually expect to see a dominant pathogen, for example, E. coli, instead of a mix of enteric and skin organisms. All in all, the culture is likely not clinically significant, meaning it probably doesn't reflect an actual infection in the urinary tract system. To get a clearer picture, it is a good idea to repeat the culture with a cleaner midstream urine sample. So, there you have it. This case teaches us the importance of interpreting lab results carefully and considering contamination when we see mixed growth in cultures. If you're ever working in the lab or the clinic, remember context is key. I hope you found this breakdown helpful. If you did, don't forget to hit the like button and subscribe for more cases and medical content. And as always, leave your thoughts or questions in the comments below. I'd love to hear from you guys. Thank you for watching.